Hello, everyone. We are on to the safety training portion of the meeting. I am going to go through the slideshow with you and quickly go over a few of the items. We're not going to go through absolutely everything because that will take a long time, but I'm going to hit on the important points of things that I want you to know. I will send you all a link to the safety training slideshow, so if you want to go through it, want to look at things a little more closely, you are welcome to. Let me just get over to the slideshow really quick. First, let me just put my information up there. I am usually in charge of the safety training and a lot of things that have to do with safety. So if you have any questions, you are welcome to text me. You're welcome to email me. You can write down this information, or all of the office ladies and all of our administrators and our BCBAs, they all have my information as well. So if you have questions for me after the meeting, you're welcome to send those to me. The first thing that I want to go over is hand washing. I know that seems kind of a silly thing for safety, but it's actually one of the most important things you can do to prevent illness from spreading through the centers. So what I want you to do is make sure you are washing your hands often. Before and after eating, of course, before preparing food for yourself or for others. I know we don't cook for any of our clients or students, but we can pull it out of the bag. We can set it in front of them. So if you're touching any of their food at all, please wash your hands before you do that. You want to wash after using the bathroom, assisting somebody to the bathroom, or after any sort of diaper change. Wash your hands after coughing, sneezing into your hands, or sorry about that, or blowing your nose before touching your face for any reason. I know a lot of us have troubles with touching our face all the time. I'm one of them. Just try to be conscious of how often you're touching your face and if your hands are clean. I don't know if you all noticed that we're getting hand sanitizer outside of every classroom. So I want to do that so that we are not only washing our hands with soap and water, but we're also sanitizing before we go into the classrooms. I will be putting up signs outside of every classroom just saying, please sanitize before coming in. And I just want that to start being a habit as we walk into the classrooms. If your center doesn't have those hand sanitizers yet, just use the sanitizer that you have already. Okay, so how do we wash our hands correctly? Remember that you're needing to scrub for at least 20 seconds and cover all of the surfaces of your hands, including your wrists. When you wash, wet your hands, get enough soap to cover your whole hand area, get your palms, get in between your fingers, get the tops of your hands and your thumbs. A lot of people forget their thumbs. I'm not sure why. And then just wash across the tops of your wrists. When you're trying to get your nails, a lot of us have longer nails. And even if you don't have longer nails, germs and dirt can get underneath those nails. So it's best, I don't know if you can see, but it's best if you take your fingers like this and scratch it across your palm with soapy hands. It gets the soap underneath your nails and helps get some of that debris and junk out from underneath your nails. Then you want to rinse really well after your 20 seconds is up. To time yourself, you can sing a song like Twinkle, Twinkle, Little Star, or sing the ABC song, something like that, and then you'll know that you've washed long enough. After you're done rinsing, dry your hands and then use a dry paper towel to turn off the faucet. The reason we want to do that is so that we're not getting the germs that we used that were on the faucet when we turned it on. So use a paper towel to turn it off. It's up to you, but I usually use a dry paper towel to open the door to the bathroom as well, especially if there's a handle that I have to pull. The reason is I don't trust everyone to wash their hands properly. So, I mean, if you're okay with that, you can open the handle however you want, but I usually use a paper towel to open the door as well. All right, let's see. Quickly for PPE, which is personal protective equipment. Really, at Autism Solutions, we're just using gloves and a mask if you want to. The gloves are for if you're touching any bodily fluids like urine, stool, blood, things like that. It just helps protect you and the other person. Masks, they're not required to be worn, but if you want to wear a mask whenever you're ill or anything like that, you're welcome to. You just feel a cold coming on, you want to wear it, or if you're just trying to protect yourself because everyone in the building's getting sick, you're welcome to wear a mask to protect yourself. Just please make sure you're wearing a clean mask. You're replacing your mask if they're the disposable ones. You're replacing those every day. If you're using a cloth one, that you're cleaning it every day and not wearing it while it's wet or soiled. We are going to go through a little bit of the suicide prevention. Really, I just want you to know the signs. Sometimes it can be a little bit more difficult if we're talking about our kids, just because they're autistic. They all have different ways of expressing themselves. And so sometimes it can be harder to notice the signs. But when you're with your client enough, you start to know what's normal for them and you can start seeing behavior changes and things like that. But this is also for other employees, friends at work. If you start noticing some of the signs, you need to do something about it. So let's just go over the warning signs really quick. If the person that you're with is talking about wanting to die, that's an obvious sign. They're feeling a lot of guilt or shame, like they're a burden to others. Maybe they feel empty, hopeless, they're trapped or having no reason to live. They're seeming more sad, more anxious, agitated, full of rage, or they have unbearable emotional or physical pain. They may be crying a lot. Changing in behaviors. So they're making a plan or researching ways to die. Withdrawing from friends, saying goodbye to people in a way that they don't normally do. Giving away important items, making a will. Taking dangerous risks, such as driving extremely fast, things that they wouldn't normally do. Displaying extreme mood swings, eating or sleeping more or less, or using drugs or alcohol more often. We have the suicide prevention number on here. It's also on the flip books that are outside or by the doors in every classroom. So those numbers are in there. You may want to just put those numbers in your phone so you have them, just in case you need them. Let's see if there's anything else I want to go. So actions for helping somebody in emotional pain, ask them if they are thinking about killing themselves. I know that's not always possible with some of our clients, but if it's a possibility to ask somebody, you can ask them. That is not going to make somebody more susceptible to killing themselves. It's just a direct question can sometimes make them think, oh, well, yeah, I kind of am. And then you can help get them safe. The next action would be to keep them safe. If they are not even just saying it, but if they're showing signs that they may be super depressed or they want to hurt themselves, you really want to keep them safe. So we're reducing access to lethal items or places. In a school setting, it's a little bit different. Really what we'd want to do is maybe take them into a quiet room or a calm down room and just sit with them, because that's probably the safest place for them. Listen to them, acknowledge their feelings, and help them connect. So it's, calling parents, calling the prevention lifeline, setting up referrals to different places so that they can get the help that they need, helping the parents set up referrals to get the help that they need, and then just following up and staying in touch after a crisis. Let's see, what else do we want to talk about? Okay, so medical emergencies. There can be minor injuries and there can be major injuries, and sometimes there's stuff that's in between. Minor injuries, such as they have a little bump on their head, they have a scrape, they have a paper cut, things like that. non-emergent, you can go to the office, fill out an ouch report for the parents, send a copy of that home with the child, and do first aid, whatever, a Band-Aid, cleaning if you need to, those kind of things. If the injury is more severe, so maybe they fell and hit their head really hard and they're bleeding, or they have an obvious break that is maybe poking out of the skin in their arm, just anything that could be life-threatening. For that, we would want to call 911. We wouldn't want to move the child if the injury is severe and leave them there unless they're in imminent danger. So if they're severely hurt and the building's on fire, we would want to get them out of there. Notify the administrator, administer as much first aid as you can. Have somebody that knows CPR that's with them. And then sometimes the emergency is a medical issue. So maybe they're having an asthma attack, maybe they're having anaphylaxis, maybe their diabetes is out of control, super high or super low, and they need emergency medicines. Review their emergency action plan. So anybody that has emergency medications on file at the school, they're going to have an emergency action plan with that medication. So it will tell you what to do in an emergency. It'll tell you who to call. It'll tell you how long to wait to call, all of those things. And we'll go over the emergency action plans a little bit more. But these emergency action plans are in the office, they're on ShareFile, and they're on Catalyst. So when you're working with a client, just make sure that you're looking at their emergency action plans, especially if they have a chronic illness. So major emergencies and injuries need an incident report filled out. The child's parent needs to be called. And then just keep in mind that sometimes what seems like a minor injury can turn into a major injury. So for instance, maybe somebody gets a bump on their head. We look at it, we ice it, we make sure that they're fine, maybe let the parents know. And then as the day goes on, they start getting confused or they start getting lethargic, those sorts of things. That's where a minor injury would turn into a major injury. Okay, for school medications, really all I want you to know is that you have to be trained to give them. The school secretaries, administration are trained to give the medications, and then there's a few other people who are trained so that they can help out the office staff if they need to. And then sometimes I'll train somebody on just one person's medications, just so that, for example, if you're walking a student to the park, you may need to take their inhaler with them in case they have an asthma attack, and you may need to be able to administer that. So there's occasions where I train just one or two extra people on one specific med. But you do have to be trained to give the medication, and there does have to be paperwork done to be able to give a medication at school. So emergency action plan is an EAP. This is for emergency medications for seizures, anaphylaxis, asthma, diabetes, seizures, those sorts of things. If they have an emergency action plan, it will be filled out by the parent, the physician. It will tell us what medications we can give. It'll tell us how long we wait in between different actions. It'll tell us when to call 911, all of those things. We will keep a copy of that in the office, on ShareFile, and on Catalyst. So if you've got, like I was telling you earlier, if you've got a child that has any of those chronic conditions, check and see if they've got an emergency action plan on file, and then just make sure that you know what to do in those emergencies. The office staff have the emergency action plans in there, and they've got the medications. So if there's a medication they can have during an emergency, they can give that. Okay, these are just some examples of emergency action plans. This one's an asthma action plan and a seizure action plan. I don't know if you can see these very well, but it's just kind of an example. It will go through like If they, for asthma, for example, if they are having mild symptoms like wheezing, you can give this medication. If they are having moderate symptoms, you can give this medication. If they are severe, you can do this and tell you, and call 911, those sorts of things, just so you know exactly what to do in every situation. And the same goes for the seizure action plan. We're going to skip choking just because you learned that in CPR. The only thing I want to mention about the Heimlich maneuver is if somebody is choking, make sure that you're calling 911 immediately. Don't wait until you've, tried it a few times before you call 911. Just call 911 and get somebody coming to help, just so that you've got that in case it turns into you need to do CPR on this person because they're not responding to the Heimlich maneuver. So just get 911 on the phone immediately and then try the Heimlich maneuver. If they pass out, go ahead and start CPR while we're waiting for help to come. I know we go over this with first aid as well, but just remember to think STAR for seizures. So for safety, S is for safety, making sure that the area is safe, clearing hazards, place something soft under the head, call 911 if there's no history of seizures. If there is a history, follow the student's emergency action plan, like I was just telling you about. Give emergency medications if they have them, and call 911 if necessary. T is for time. We always want to time how long the seizure lasts. Take extra steps after 5 minutes. So follow the emergency action plan. Usually after 5 minutes, they want you to call 911. A is for act calmly. You set the tone of the emergency. If you're panicking, the people around you will panic, and the person who's having the seizure or had the seizure may panic as well. So you set the tone. You be as calm as you possibly can, even if you're not feeling calm inside. R is for recovery position. After a seizure stops, place the person on their side in the recovery position. This just helps with blood flow and keeps them from, like, if they happen to throw up, they're not going to choke on their vomit. The other R is for record and report. So recording details of a seizure is super important. Even if you don't know what kind of seizure it is, you can describe the seizure and you can time the seizure. So you just want to make sure that you know how long it lasted, approximately. I know it's when it happens suddenly, it can be hard to time something, but approximately how long it lasted and what the seizure looked like, just because medical providers are going to want to know that information. Okay. Allergies. There are minor allergies and then there's major allergies. Minor allergies are like maybe, they get extra swollen from an insect bite, or maybe they get little tiny hives or a little rash, or their nose gets runny, things like that from different things. Most of our kids that have these minor allergies don't have medications that we can give them. Some of them will have maybe Benadryl or Claritin, things like that we have in the office that we can give, but a lot of them don't. If they seem to be having allergy symptoms and they don't have medications, you can always call the parent and ask them to bring something, just to help them with that. Now, major allergies can cause anaphylaxis. Anaphylaxis is the one that we're the most worried about. It's serious, it's life-threatening, and it's caused by an extreme sensitivity to something. So usually with anaphylaxis, they'll have anxiety, kind of that sense of doom, chest tightness and wheezing, shortness of breath, crying. They may have a change in their level of awareness, vomiting, nausea, diarrhea, fainting. They may be flushed or have pale skin, have bluing around their nose and mouth, rash or itching anywhere on the body, itching and swelling of the mouth and throat. This is a life-threatening emergency. Usually the airways close down fairly quickly. Most people that have anaphylaxis know their allergy and have an EpiPen available. But sometimes there are times when they don't know that they are severely allergic to something, and it may be their first time having an anaphylaxis reaction. So if you notice that this little rash is spreading, or they're starting to have difficulty breathing, or there's any, weird changes in that person, assume it's anaphylaxis and just call 911. If they already have an emergency action plan on file, go ahead and follow that emergency action plan. They'll have an EpiPen available. We always give the EpiPen first if you're alone. If you're not alone, you give the EpiPen while somebody else is calling 911. Give that EpiPen, call 911. Even if you have an EpiPen, you have to call 911. The reason is that EpiPen is only going to last so long. Most of the time, and some people carry 2 doses, but most of the time, after 5 to 10 minutes, they'll start having another reaction and they'll need more medicine. So that's why we want 911 to be called immediately so that they can get there and help as that EpiPen starts wearing off. The only things that I really need you to know for asthma at school is just the signs of an asthma attack. Again, your kids will have an emergency action plan if they have known asthma. The signs can be shortness of breath, tightness in the chest, wheezing, nasal flaring, pulling in of the neck and chest with breathing because they're trying so hard to breathe in, they'll use all of those extra muscles. Incessant coughing, rapid labored breathing. They can't speak in full sentences. They might be sweaty or clammy, and they need immediate intervention. So if they've got that emergency action plan, they'll have medications such as albuterol that can help open those airways back up for them. Some things that you need to think about is preventing an asthma attack. So some kids have trouble with exercise. Some kids have triggers such as allergens or if there's a bad air day or animal dander or dust, things like that can trigger an asthma attack, chemicals and harsh smells. So just make sure you check the emergency action plan because sometimes if one of their triggers is exercise, they may be able to use their inhaler before they exercise just to prevent an attack later. So just if you know your kiddo has asthma, look at their action plan. And then obviously if their inhaler isn't working the way it's supposed to, there will be a plan in place for, okay, if the inhaler is not working very well, we can give it this often and call 911, that sort of thing. So just keep an eye out for those emergency action plans. Okay, so I'm just going to put this up really quick. Here's the emergency numbers we need to know. Dial 911 for fire, medical, police, poison control. Good idea to have that into your phone just so it's always there. There's the offices listed here and the suicide prevention hotline. All of these numbers are in that flip book that is in the classroom right by the door. So you're able to just flip that open and pull it up, but it's also a good idea to just put these in your phone so that you've got them. Okay, so for fire safety, we do fire drills quarterly, so we should get pretty good at knowing where to go and how to leave the building and things like that. Really, I just want you to know that if a fire alarm goes off, in general, you're going to want to use the closest exit to you. RBTs, I want you to make sure that you've got your client with you and that you're getting out of the building. Teachers, the biggest job I have for you, or if the teacher's not in the room, somebody else can do this, but is grabbing that emergency red backpack that's in the room, making sure your classroom is empty, turning off the light and closing the door, because that just tells everybody nobody's in here, it's safe, go ahead and move out. That's really the job I want. And then helping, of course, helping with clients that are having troubles getting out. Same with BCBAs. I really just want you to be helping where help is needed. So if one of the clients is dropping to the ground when we're trying to evacuate, they may need help getting that client out of the building. And then administration staff, again, we're the helpers. We're looking as on our way out, seeing what we can do to help. The office staff is going to have a list of all of the clients. They're going to take roll when we get outside and then decide who's going to call 911 and then designate people to call parents if we need to have parents come pick up. Let's see. I don't know if I need. Oh, so I'll just go through this real quick. All of the centers have fire systems that automatically go off with the detection of smoke. However, in West Jordan, there are fire poles that you can use if you happen to notice something before the smoke detectors go off. If you are in the other centers that don't have fire poles, you can always use that emergency chat that we do drills on. You can always put like, hey, there's a fire in the kitchen. Everybody needs to get out. And start trying to help people get out before the smoke alarms go off. The fire department may be notified automatically when the alarm is activated, but as soon as everyone's outside, we're doing roll. It does not hurt to call 911 and just make sure that somebody's on their way. Fire extinguishers, I just want you to know where they are. Most of the time they are out in the hallways or near the kitchen. So make sure that you're looking around your center and just seeing if you can find your fire extinguishers. Now, we don't expect you to use a fire extinguisher at all, honestly. If there's a fire, we really just want you to get out of the building and be safe. Now, we have them just in case, because there may be a situation where you cannot get out of the building without putting out some of the fire to get out of the building. In that case, let's go over how to use a fire extinguisher just in case you need to. So remember, pass when you're using a fire extinguisher. First, you're going to pull the pin. Then you're going to aim the hose. You're going to squeeze the handle and sweep the extinguisher back and forth. Usually you're going towards the bottom of the flames. And then, as long as you get it out enough that you can get past it and get out of the building, then that's good. We are not asking everybody to risk their lives to save the building. We just want you to get out and be safe. For earthquake safety, I just want you to know that really we're going to just prompt and assist our kiddos to get under a table if they are able to, a table or a desk. That just prevents things from falling on top of us and hurting us. If there is no table available, we're going to just get down on our hands and knees, cover our head with our hands. I know that may be hard with some of our clients, but just do the best you can to get into a safe place. We're going to avoid windows, possible falling hazards such as shelves, bookshelves, things like that. Once the shaking stops, we're going to just evaluate the situation. If it's a minor earthquake, probably nothing needs to happen. If it's a major one and there's, structural issues, there's a gas leak, things like that, then we need to evacuate the building and follow that evacuation procedure. Don't move anybody that's seriously injured unless they're in danger. And don't use electricity, flames, or anything like that until you know there's not a gas leak. If there is an injury, call 911, go through those steps. And then remember when you evacuate to take those red emergency bags. Even if you don't evacuate, if somebody's injured, there's first aid kits and all sorts of things in there that can help. Okay, lockdown. We just did a lockdown drill, so we kind of know what we're looking for, but for those who weren't there for it, if you see something suspicious, somebody's kind of creeping around the building, or if we get a call from the police maybe that says, hey, there's somebody out here running from the police, we need you to lock down, that's when we would use this. So, and we'd also use this in a active shooter aggressor situation. We have the whole run, hide, fight thing, but during an active aggressor situation or an active shooter situation, if you can't run, we would use the same procedures as a lockdown. So if you see or hear something suspicious, notify the front office and as many people as possible via the emergency chat. Call 911 if it's appropriate. When you're notified of a lockdown, check the hallway and bring any students into the room. Close and lock the classroom door if possible. Turn the lights off. Close the blinds or cover the windows if possible. And then you're going to text in the group chat which room you're in. And if, like, for example, if we're in Melanie's classroom, we'll say, Melanie's classroom green. That just means all students are present. There's no extras. Or Melanie's classroom is red. We're missing, or we have extra students. And then we're going to list the students who are extra or who are missing. Students should sit in a group on the floor away from windows and doors as much as possible. They can crowd into a locked closet or bathroom if you want, if you need extra security. And we're going to keep the students as quiet as possible. I know that's going to be really hard. There are some snacks and there are some fidget toys in all of the backpacks that may, calm some people down. And then we're going to keep our cell phones on silent. And then once everything is all clear, whoever gets that information first will post in the chat, we're all clear, we're good to come out. So going through an active shooter aggressor situation, the federal government has their Department of Safety. This is their thing. The run, hide, fight is how they want you to handle an active shooter or aggressor situation. I know it can be scary to think about running, especially if you don't know where this person is. But people who run and get out of the way, get out of the situation, have a better chance. So if you are not going to put yourself in harm's way, if you can look really quickly into the hallway and see that it's clear, and there's an accessible escape path, try to evacuate, because that's the best way for you to get away from the situation. So in any room that you're in, be sure that you have an escape route and a plan in mind. Evacuate regardless of whether others agree to follow. So if you see an escape route and nobody wants to come with you, go ahead and go. Try to take people with you if possible, though, especially our clients. We don't want to leave them behind. Leave your belongings behind. Help others escape if possible. Prevent individuals from entering an area where an active shooter may be. So if you know where this is happening and somebody's heading that way, get them out of the way. Keep your hands visible in case the police show up. You don't want to have anything in your hands that they may think that you are the shooter. Follow instructions of police officers. Don't attempt to move wounded people, and call 911 once you're safe. For hide, we're just using that same lockdown procedure. So we're going to find a place, any place that may have a locking door. If it doesn't have a locking door, we're going to use something to block the door, something heavy to block the door. We just want to prevent the aggressor or the shooter from getting into your hiding place. So lock your door, silence your cell phone, turn off any source of noise, try to keep those kiddos quiet as much as possible, hide behind large items if you can. Try to remain calm, dial 911 if possible to alert the police to the shooter's location. If you can't speak, you can leave the line open and let the dispatcher listen. Now, if it comes down to it and you've tried to hide and you're still going to get into a confrontation with an active aggressor, that's when we would fight. So this is only as a last resort and only when your life is in imminent danger. We're going to attempt to disrupt and or incapacitate an active shooter by acting as aggressively as possible against him or her, throwing items, improvising weapons, yelling, committing to your actions. So any hard or heavy object can be used as a weapon. So for example, fire extinguisher, it can be used as a weapon just by hitting with it, but you can also open it, pull that pin, and use the fire extinguisher on them because it creates a diversion. Mugs, vases, lamps, chairs, really anything you can pick up and use as a weapon to protect yourself. And hopefully we never have to do this. Let's see, what is this one? Oh, it's just a note that we're still in the process of purchasing a few emergency door locks and window blinds for some classrooms. So those are coming. But look in your classroom and see what kind of lock you have, any classroom that you're in regularly. It may just be a regular lock on the door, or it could be a security bar. If your classroom has a security bar, familiarize yourself with it and make sure you know how to use it. This is what the security bars look like. It's kind of a long white tube with a black Y-shaped rubber piece on the top and a black rubber piece on the bottom. That's the foot. So this, you adjust the bar to fit your door size, and then you place that Y rubber part up underneath the door handle. And then you put that black foot on the floor, and then you push that bar closer to the door until there's a good seal on the door, until the door can't open or close. Most of these security bars are kept right by the door. If your classroom does not have it right by the door, just make sure you know where it is. And then the last of this is just how to respond when law enforcement arrives. I'm not going to go through all of this. It's basically just telling you that that you need to listen to commands and make sure that your hands are empty and that you put your hands up, because they don't know who an active aggressor might be. So the first officers to arrive to the scene will not stop to help injured persons. The reason is because they're trying to get into the building and stop the active aggressor or shooter. So they're not going to stop and help somebody who is hurt. Once they get control of that person that is causing the problem, then a rescue team will come in that has additional officers and emergency medical personnel to follow the initial officers. Then they'll treat and remove any injured persons, and they may ask anybody who's able-bodied to help them remove any injured persons out of the building. Once you've reached a safe location or assembly point, you'll likely be held by law enforcement until the situation is under control and witnesses have been identified and questioned. Do not leave the premises until the authorities tell you to do so. I believe that's all I'm going to go through for today. But again, I'm going to send the link to the safety training to you all so that you can look through it. If you have any questions, I know there's no time for questions and answers right now. So if you have any questions, please feel free to text me, email me, whatever you need to do for that. And I will get back to you as soon as I possibly can. Okay, I think that's it. Thank you so much.